Osteoporosis and osteopenia, bone health for women is important, and really it's interesting, people focus on it a lot in menopause because that's when we see an accelerated bone loss. But this again is where, as OBGYN providers, we can affect bone loss early on in women because we're finished developing bone by the time you're 25. So if you don't know the importance of maintaining strong, healthy bones through diet and exercise and calcium and vitamin D before you're 25, you're not making any more bone after that. So you're maintaining. There is an accelerated bone loss, and for different reasons in women, as they go through menopause, sometimes for medication reasons, other health concerns. So we, again, can identify what may put them at higher risk for more accelerated bone loss. We know that if women have low impact falls and fracture, that they are at a higher risk for ending up in a nursing home and then having a cascade effects that will negatively impact their health. So it's all about prevention at that stage. And so we can talk to them about weight-bearing exercise, about calcium and vitamin D needs, about screening for bone health. And again, for them, the most important thing we can do is prevention. In general, the guidelines at this point are starting at 65 for women to get a bone density screening done. It's very easy. It's not a difficult test. You lay on a table and they take a picture of your hip and a couple pictures of your spine, and they calculate the density of your bone, and they compare it actually to a 25-year-old. So you are being compared. So if you have normal bone density at 65, you've got some 25-year-old bones, and that's kind of something that women like to hear. So that's what a bone density test is. Now, we will do bone density tests earlier on some women if they have high risk factors, and that family history, personal history of fracture, medicines that can affect their bone loss, or disease states that would accelerate bone loss.